Hello and welcome back. Today we're going to talk about reducing the risks and coping with chronic conditions. We're going to talk about different types of chronic conditions, some respiratory conditions, things like bronchitis, emphysema, and asthma. We're going to talk about allergies, some complications and susceptibilities. We're going to talk about some neurological disorders like seizures and headaches. We're going to talk about a few chronic digestive disorders like inflammatory bowel disease, and we're going to talk about some neuromuscular skeletal diseases like lower back pain and so forth. Chronic diseases are conditions that develop over long periods of time. They can be progressive, and the pain or conditions associated with them can be difficult psychologically to manage. There are some things we can do with lifestyle and personal health to manage these diseases, but they do affect many millions of people. So what are some of the more common chronic conditions that affect college students? The most common one is allergies. Allergies, seasonal allergies, and other kinds of allergies are prevalent in the college community. About 1 in every 5 people suffer from allergies. Associated with allergies are frequent sinus infections in many people. Lower back pain is incredibly common. Oftentimes conditions that students are sitting in or working out in can cause lower back pain. Sore throat, migraine, asthma, all very common conditions seen in college students. Let's talk about respiratory conditions, some chronic respiratory conditions. They are the 3rd leading cause of death in the United States. About 155,000 people die from respiratory conditions every year. These are disorders that affect lung function. They include things like bronchitis, emphysema, and asthma. Bronchitis can either be acute or chronic. Acute bronchitis is caused by an infectious disease, something that you may see after an infectious disease, a viral infection or so forth, would be inflammation of the lungs. This is bronchitis. There's a different type of bronchitis or chronic bronchitis that affects about 9 million Americans. Chronic bronchitis occurs over months and years. It's diagnosed when bronchitis or inflammation of the lungs occurs for 3 months of the year for 2 consecutive years. Emphysema is similar to bronchitis. It's related. It's impaired lung function, sometimes with breathlessness or choking sensation. Around 3.5 million Americans suffer from emphysema. Emphysema is sometimes thought to be mostly affecting males, but women are also diagnosed with emphysema. Common cause of emphysema is smoking. Emphysema involves the gradual destruction of alveoli, or the air sacs in lungs. This impairs the transfer of oxygen into the body and carbon dioxide out of the body. It makes it harder for someone to breathe. Cigarette smoking is, as I said, the most common cause, although exposure to air pollution can also cause lung damage and result in emphysema. Ultimately, this disease has to be treated with bottled oxygen, and people carry around oxygen with them, or indeed they can't move because they just their body is not delivering sufficient oxygen for their body to move. Asthma, chronic inflammatory condition. There are usually things that trigger asthma. For some people, like myself, asthma is triggered by exercise or cold, dry conditions, but for other people, asthma can be triggered by other environmental factors, things like pollen or dust. It's very common for allergies to trigger asthma, in fact. Asthma inflammation causes restriction of bronchial tubes, sometimes mucus accumulation in the bronchial tubes and remodeling of the bronchioles, reducing lung function. Long term, it should be treated. There are good treatments for asthma to reduce the effects of asthma. Here are some treatments. Inhalers like Ventolin or ProAir contain chemicals that help to open up airways and prevent the remodeling and the damage caused by asthma. Asthma is very prevalent. You can see that around 8% of children and adults suffer from asthma, and that it's prevalent in large groups of different race and ethnicity. Let's talk about allergies and coping with allergies. An allergy is when the body attempts to defend itself against a specific antigen, a specific thing in the environment. This is often a trigger for asthma. Allergic reactions are hypersensitivity reactions, where a person is overly sensitive to an environmental antigen. Sometimes that will be a mold, or animal fur, or pollen, or grass, or dust. And sometimes allergic reactions occur in response to foods like peanuts, or milk, or shellfish. And occasionally, allergies occur in response to medicines. If you have an allergy to a medicine, it's important that you let your doctor know about that. Hay fever is one of the more prevalent allergies that we see. That's a response to grass or pollen, ragweed, flowers. Sometimes people are allergic to plants in the spring. Sometimes people are allergic to plants in the fall. Sometimes it's all year round. It can cause symptoms like sneezing and itching, watery eyes and nose. Then there are food allergies, often triggered by things like milk and eggs or peanuts, soy, fish, shellfish. Recently sesame was added. You should know that manufacturers are required to put common allergens on food labels, so read food labels very carefully if you suffer from a food allergy. Some symptoms include swelling of the mouth and lips. If it gets to the point of difficulty breathing, you may need to carry an EpiPen to help treat exposure to one of these food allergens. Sometimes people suffer from stomach pain or diarrhea in response to food allergens as well. For mild food allergies, taking an antihistamine such as Benadryl can be helpful. Let's talk about neurological disorders. These are very common disorders of the nervous system. Some of the most common disorders are migraine headaches. Very, very common, and may require treatment. There are effective pharmacological treatments for migraine. It's also important to get the rest you need and reduce stress to reduce the incidence of migraines. In addition to migraines, there are disorders like epilepsy that should be treated, diagnosed, and treated where possible. It can be dangerous to have an epileptic episode, particularly if operating heavy machinery such as a car or something like that. But yeah, headaches. There are tension headaches, often caused by muscular tension. Then there are sometimes cluster headaches, which can cause pain behind the eyes. Typically, resting and taking an anti-inflammatory over the counter. Anti-inflammatory will help these conditions. Sometimes headaches can be caused by allergies. Sometimes headaches can be caused by withdrawal from caffeine. That would be a sign that your caffeine use is excessive. And sometimes headaches can be caused through exertion. Some people, when they work out particularly hard, can develop migraines and headaches. Eye strain is a common cause of headaches in college students. Try to give yourself a break regularly, maybe every 15 to 20 minutes. Move away from the computer screen or the small screen that you're looking at and let your eyes relax. Look at a distant horizon, for example. Hangover causes migraine-like symptoms. Here is thought that alcohol causes some dehydration of cerebrospinal fluid, reducing the amount of fluid around your brain and causing a headache. And hunger can also cause headaches in some people. Sinus pain can cause headaches as well, and frequently that's a cause of headaches. In rare cases, the sinuses may need to be operated on to open them up to prevent infection, but oftentimes decongestants and antibiotics are sufficient to treat sinus conditions. Let's talk about some seizure disorders, such as epilepsy. It's caused by abnormal, excessive electrical activity in the brain. Most people that are affected by seizures can lead perfectly normal lives. Treatments are very, very effective, and it's a rather common disorder. If you notice somebody having an epileptic seizure, please try to make sure that they are safe and they cannot harm themselves. Typically epileptic events don't last too long, and that person will recover quite rapidly, but do make sure that their breathing is, their airways are open, and that they're not choking or suffocating in any way, and just let the epileptic seizure pass. If you're concerned, call 911 and call, get some help. Coping with digestion-related disorders. Here I want to talk briefly about some complex digestive disorders. Some of the symptoms can start off rather mild, but sometimes these can become chronic conditions, such as inflammatory bowel disease or Crohn's disease, and they can be very dangerous. Celiac is another condition that we want to be mindful of. Let's talk about those disorders. Here we're talking about inflammatory bowel disease. Inflammatory bowel diseases are inflammation of the large intestine. It can cause stomach cramping, bloating, pain, bouts of diarrhea, sometimes bloody diarrhea. Ulcerative colitis involves inflammation in the distal portion of the large intestine. That's the end of the large intestine, whereas Crohn's disease can occur all throughout the large intestine. Both conditions are very serious, but there are very effective treatments, and sometimes it requires mapping out of triggers. Foods can trigger ulcerative colitis and Crohn's disease in many people, and diets may need to be managed carefully.